I believe the doctor's here with Moncrief, is that correct? Yes, sir. If there's no objections, nobody minds, we'll let them go ahead and make their presentations. We'll back to item number 4 at this time.
Judge, Commissioners, thank you so much for having me today. I'm Keith Argybright. I'm the director of the Moncrief Cancer Institute. And some of you might remember or be aware of the Moncrief Radiation Center that was in Fort Worth for a very long time. A lot of people knew someone who had gotten cancer treatment there. Well, we've changed our focus just a little bit. We do now much more cancer prevention and cancer survivorship. Well, what exactly is survivorship? We've gotten so much better at being able to treat people with cancer. A lot of times whenever they leave their treatment, they weren't what they were before they started. They've got either stamina or depression issues or nutritional issues. And so Moncrief has really put together a program to get people well after they have successfully gone through their chemotherapy or their radiation therapy or their surgery. And we've been providing these services for the past several years at our new location on Magnolia there in Fort Worth. Some of you might also be aware of the 1115 waiver program, which is a program that's taken on by the federal government as well as the state Medicaid office to look at new ways of delivering care to the people of Texas. And we successfully competed for one of these 1115 waiver projects, which will essentially be bringing these survivorship services from Fort Worth out into the counties of the Region 10. And so you can see here somewhat through the map of Region 10. You can see, here we are in Somervell. I was just in Stephenville a few minutes ago addressing their county commissioners. Hood, Johnson, Ellis, Navarro, Tarrant, Parker, and Wise are the counties. And so how are we going to actually get this done? Well, if you'll flip forward a couple of pages, you'll see this right here. And this is the customized clinic that we are building through the 1115 waiver project. This is on an 18-wheeler platform. It has a couple of exam rooms. It has a exercise facility. It has a little waiting area. It has a place for screening mammograms. And what we will be doing is we'll be bringing this clinic staffed with nutritionists, staffed with counselors, staffed with nurses, staffed with radiology technicians for the mammogram. We'll be bringing this clinic to those counties roughly twice a month starting in March. And what we're looking to do is get those people who have been through cancer and might need a little bit of help getting back on their feet from either a physical or an emotional or a nutritional or a psychological standpoint. This is all covered through the grant. So the equipment, the people, the advertising, all of this is covered through this 1115 waiver project. We work very closely with our partners here in the county, whether it be the hospital or the clinics or the social agencies or the American Cancer Society. We're not here to displace anyone. We're here to help people and to work with the people who are here already in the county in order to deliver these services. These services are of no cost to people who are part of the program. Now, we're focusing mainly on those people who are underserved, underinsured, maybe on Medicaid. Those are the ones that we want to get because most often they're the ones that can't afford it. Anyone can be part of this program. We'll take anyone, but we're really focusing on those people who don't have the insurance and don't have the ability to have access to a program like this. I'm here today, first of all, to inform you and let you know that starting in March, this is going to be in your county about a couple of times a month. Number two, to thank you for all your support. I've been with the judge before, and it's great to see you again. It's great to be able to address the entire court today, and so wanted to thank you for your support. And then thirdly, wanted to let you know that people are going to be asking you about what is this, or how can I participate in this, or I've got cancer and I need some help. And so we, at the very back here, you've got my information, you've got Julie Johncock's information. Please use us as a resource. Again, this is going to be a visible program. We'll advertise in the local paper. We will be at events. We will be working with our county partners. And so a lot of times people will call your office and say, look, I've got a problem and I need some help, and we want to encourage you to use us as a resource. So thank you, and I'll be happy to answer any questions that you might have about this.
So implementation of this program going forward, you will advertise as to locations, dates, and when you will be in the community?
Yes, sir.
Will you coordinate with any of the cancer survivor groups in the community to?
You know, it's really interesting because I guess it was probably 4 or 5 months ago I actually addressed that cancer survivor group, and we had a meeting there at the hospital. I think they meet in the hospital lobby, and wow, what a great resource. It's very unique, by the way. Not many counties have been able to develop and sustain something like that. So we've already plugged in with that group. As I said before, I met with that group back in the summer. They said, when can we have this? And I said, well, I've got to get this truck built first. and so yes, we are already aware of them and plugged in with them as well. I believe that the indigent care program runs out of the judge's office. Is that right? The hospital. Yeah, everyone's. I've got to keep 9 different programs straight, and yeah, that one runs out of the hospital. And I've spoken with hospital CEO about that, and he's very he's actively enthusiastic about this. You know, again, you know, working with the people in the county is the key to success here. We're not here to take anything away. We're here to add to what you already have.
Any other questions? Thank you very much.
Thank you. I appreciate it.
Thank you all.